Hello.
Hello.
I don't speak Slovak, so I've got to do it in English. Excuse me. You've asked me about...
It's fine, it's fine.
Okay. I want to tell something about science to the market. And of course, I've got some experience with that because I've set up several companies and I brought with this company science to the market. So I give you first some general, I make some presentation about that. Oh, this goes wrong.
Okay, I think...
One moment.
It will be fine. You can continue.
This goes wrong. This goes completely wrong. Yes, this is okay.
Now we see it. It's okay.
Yes, okay, that's fine. I want to talk first about, let's say, an introduction. You've got, when you have science to the market, you bring two things. You've got recognized as large companies, as small companies, what sort of field. I talk a little bit about general innovations because my background is pharma, and I think that's new for you. So I talk a little bit about pharma and about my experience, what has worked, which working together with universities and with a small medium enterprise, which I've started several times, what is working out of bringing a product to the market. And if needed, I can tell you my story. First of things, we've got to see that large companies, most of the innovations have been formed by good background thoughts, strategic surveys, and extension of several lines. We've got to realize that if you work in a large company, it's very political. But political can be conflicting with innovation because you do it for 4 years and then you change it. And you've got a lot of bureaucracy and that sort of things. In contrast to that, small, medium enterprises, they're seeing possibilities, and that's more person or a group of persons related. The other things of large companies, they have a real budget. They have really access to the brightest persons, always a large access to network of knowledge-based institutions. And don't forget, they know exactly which set of patents are in the world, and they can buy these sort of licenses of these patents of also the backend of those patients. Next to that, in large companies, there's mostly a form of promotion. If you got a good idea, you want to be a high position. So in most of the large companies, within 4 years, you got a different position. That changed innovation completely. Don't forget that, because innovation is mostly, and science, mostly long-term, not small-term. The difference to that with a small, medium entity is that they've got limited resources, less amount of money, but they've got a vision. And I always say what's very important is they're naive. Sometimes they don't look about problems, they want to solve things. I give you some innovation background. If you talk about electronics, in fact, electronics, you can say that's very predictable. According to the law of Moore, that's about electronics, they say every 2 years you've got a double capacity of chips. That in fact, it means that you can schedule a lot of these innovations by this. It relates to pharma. Pharma have innovations based on a known cure. You want to solve that. You can do it very simple. Let's say there's an existing drug and you want to do things better. For instance, if you want to lower cholesterol, you've got different forms of cholesterol lowering products and different forms, they call it statins. Next to that, you can use of known principles. For instance, we know nowadays with the good DNA technology, we can produce all forms of proteins. Next to proteins, we can produce all forms of antibodies. We know the proteins, for instance, if you have less insulin when you're sugar patients, you can produce insulin, which is a recombinant protein. And if you have got a disease like form of cancer, you can produce antibodies against these sort of cancer. But what we've seen in pharma, that large innovations are not predictable. So for that reason, the large pharmaceutical companies let small companies do all sort of strange things, and when they are above a certain level, when they have risk diminishing, they talk about risk diminishing, they buy that sort of companies or license it in. With that gives you to not innovation which is not predictable. Where do you get the innovations come from? In fact, most of the innovation in pharma, and I've got the experience with that, is coming from universities, because there's knowledge about specific diseases. The doctors know it. They work about all sort of working mechanism. Where does the body doesn't have an answer to that, or where things go wrong? You look at all sort of mechanisms. Next to that, you got all sort of conceptual thoughts. I mean, how is a disease? Is it inflammation? Is it bacteria influence? How do you solve that sort of things? These are conceptual thoughts, bacteria. But we've got to realize that one observation is not a product. A good idea is never a product in pharma and in a lot of things. You need development. So if you've got the science and you want to bring it to the product, to my opinion, the university is not realistic, because the organization of a university is that university wants to publish, and they have got different groups. They have small amounts of money. They have got they have very dedicated amount of money for research. And in development, you need to have different attitudes. It goes well, it doesn't go. You've got to find a solution. And that's not, even if you work with very bright persons, that's not the realistic side of a group inside university. To my opinion, then, a small mellow entity is the best option for the development process. Why? They are pragmatic. They like to go to work with universities. And I think that's important. Important is that you must trust the people in universities, and there must be a good working together attitude of people in university and small, medium entities. And there's money is in the background. Please try to avoid money. Go for the results. So the money must be contracted before starting. Make a very good realization, so everybody knows when there's money coming in, where it's going through. Because for development, a lot of money is needed. And be very transparent in that sort of things. Another thing of the SME is that it can go with different groups. And how can you pay that? You can have cash inside the SME. It can be of investors. It can be, and I think that's a very important point. There are a lot of grants and other forms of not diluted funds. And I think an SME can use that and must survive by this. It's not only invest. They must be very flexible also with try to find the money. And you learn a lot of things about that. And in fact, you're creating an environment with that. This is a short story about how things are going in the pharma industry. You start with a lot of compounds, and at the end, probably you have a drug. But it's all risk with a huge amount of cost. And we have experience with that because we have developed a compound in Alzheimer's disease. And we are nearly going into human. I think I will end. This is my time, I think, for talking about SME. So I stop here. Are there some questions about this attitude?
Má niekto nejakú otázku, ktorú by rád položil? Do you have any questions here, Mr. Velič?
Thank you for a nice presentation. I really enjoyed that because maybe you didn't get a chance to listen what I was saying because it was in Slovak, but it's exactly what I was saying here in Bratislava, that the future for innovation is really linking with universities and small and medium enterprises. I fully agree. I think that gives the flexibility and also kind of the intellectual content. But I have a question. I mean, how do you deal as a small and medium enterprise with the patents? Patents are extremely expensive, and if you want to cover all those patents along the way, it's basically a financial burden. I mean, how do you deal with patents?
Give me an example. We pay about 200,000 euro a year at this moment for patents. And I've done it for the last 6-7 years. Yes, how we solve that?
So you said 250,000 per year, so it's roughly like 10 patents a year, right?
It's not only patent, it's all around. It's when you, for instance, the cost of a patent only in Europe, first you start it and then you must pay it for the country. You talk about, let's say, 70,000 to 100,000 euro. So it's only one patent. I've got 10 patents on my name for this sort of things. That's correct. But you need all sort of background information. You try to find against patents. That's also a stupid thing. But sometimes you need to have broadening the patents. But the real question is, how do you have paid it? And I'm still paying it. What I've done, I always have tried to get the cash out of my other companies and paid this venture. I'm very cash driven. But it's a lot of money.
Mr. van der Graaf, thank you very much for your presentation. Good luck and have a nice day.
Thank you.